Welcome back to our YouTube channel Histology. In this topic we will discuss the topic about renal histology, tubules, glomerulus, and nephron. The study mainly involves renal histology. It is a study concerning the microscope examination structure of a kidney with different functional components like nephron, glomerulus, and related tubules. Each one plays a crucial role for producing urine, reabsorption, and filtration of blood. 1. Nephron. This is the structural and functional unit of the kidney through which it generates urine. Nephrons comprise an approximate population of 1 million in every kidney. There are two major components. Renal corpuscle. This includes Bowman's capsule as well as the glomerulus. Renal tubules consists of the collecting duct, DCT, distal convoluted tubule, loop of Henle, and PCT, proximal convoluted tubule. Structure: glomerulus, capillary network which aids in blood filtration. The Bowman's capsule collects the filtrate, the glomerulus being encircled by it. Proximal convoluted tubule, PCT, reabsorbs nutrients, ions, and water. Loop of Henle, U-shaped structure with ascending and descending limbs that collect urine. Distal convoluted tubule, DCT, modifies the composition of the filtrate by fine-tuning secretion and reabsorption. Collecting duct, it links the nephrons with the ureter, thus providing a location where the balance of water and solutes can be manipulated. 2. Glomerulus. Most blood filtration occurs in the glomerulus, which has been identified to be a specialized tuft of capillaries. Its role is to screen large molecules within the blood, such as proteins and blood cells, from the filtrate but let water and other minor solutes pass. Histological features: endothelial cells are fenestrated, therefore, line the glomerular capillaries, through which water and solutes pass. Podocytes, they have foot processes acting as a filter for the Bowman's capsule epithelial cells. Mesangial cells, these can contract or expand, thereby modulating filtration and providing structural support. 3. Tubules. The nephron's tubules may reabsorb or secrete substances, hence, adjust the concentration of urine. Categories: PCT reabsorbs water, sodium, chloride, glucose, and amino acids in 60 to 70% of the filtrate. Henle loop. Descending limb, water is reabsorbed due to its permeability to water but not to solutes. Ascending limb, water impermeable but actively moves ions, helping in the process of creating a gradient for the concentration of urine. DCT, it secretes potassium and hydrogen, and absorbs sodium, calcium, and chloride to regulate the pH. Collecting duct, this one modulates the final concentration of urine by controlling sodium and water reabsorption. Its function is hormonal and subject to modulation by aldosterone and antidiuretic hormone. Histological features of the kidney tissue. Cortex, this section has glomeruli, PCT, and DCT. Under the microscope, glomeruli appear as dense, round bodies, and at the border of the PCT, there is an easily visible brush border. Medulla, predominantly collecting ducts and Henle loops, most of the time, it seems to be the extended forms. Clinical relevance: glomerulonephritis, inflammation to the glomerulus can cause reduced filtration. Tubular disorders, damage to the tubules itself is the reason behind acute tubular necrosis and similar conditions, disrupting the secretory and reabsorptive mechanisms. Thank you so much for watching us.